Minista wa Uiiti na Uima wa Mwenenthi Aden Duale Niwathingiliila Kithito cha Silikali cha Kumina Mathina ala Mkonetwe Muvangoni wa Taifa kia Aineenea Mombasa Mbee wa Nzama ya Mbunge ya Maundu Mauiiti. Duale Niwakania Masivitali Kana Nimekwithiwa Mayikumbilwa Nimekwithiwa Makwatikana Matekuthukuma undu vailite niwaelesekana Miao wa Uiiti wa Social Insurance Act wa mwaka wa 2023 wa vitukithiwa Kenya Mbee wa milioni 20 katono ina nimaminite kwiyandikithia Angelina Musena mauvo.
Aineenea va kauntini ya Mombasa kavindani kala wakomana na komiti ya Maundu ma Uima wa Mbunge nene Minista Muvangoni wa Uiiti na Uima wa Mwenenthi Aden Duale niwawetekana yu Silikali niende kukitana na ulusani kuikithia kana Masivitali mainongela namba ya awu mataanite kiwango kila cha ilitenekana kukwata ilovia siasha.
And for Shiva are all salaried people, both public, private, and that's why the CEO said for those who will not comply with the deduction for their members, coming next month, they will pay interest. The license we give to both public, private, faith-based referrals, including Kenyatta Hospital. It indicates the number of beds. Like for example, Kenyatta National Hospital has a bed capacity, not the private wing, the ordinary wing, of 1,800. SHA will only pay for 1,800 full capacity. The days when Kenyans will be sleeping on the floor, some Kenyans will sleep 3 or 4 on one bed, and then you claim 4 beds, including the floor, to SHA, is over.
Duale nukuwetekana itina ukunikiliula atwaiwe Masivitali amone maavikiye kuvingwa na kuveno license ni kumana na mutuo u na ula ukuwetekana ni makukitana na uwe undu vailite.
In Kenyatta Hospital, in our referral hospital, we have got what we called disaster emergency fund, which I did last week. Yesterday we didn't have any fatalities, we didn't have any critical, but we had about 49, I think. Yes, am I right? Yes, 49, and we are treating them and they will not pay. It's part of our social corporate responsibility, and this goes to all our referral hospitals. But those who went to private hospitals or county hospitals, that one you'll ask the leadership there. Me, I can only speak for referral hospitals.
How do we get a situation where nobody is actually left to suffer? And also we do not promote fraud. That is the role of the Health Committee of the National Assembly.
Wanawevo utumiwa Maundu ma digital ungua Taifa keani wawetokwithwa yu minanete kuvetanga isese milioni 3 na ila sina atwaisi ya wangangani ilovia Kinandu ni kikuu cha Uiiti cha NHIF.
Issue of fraud. There is no one-way fraud. It is not possible that a healthcare facility is defrauding SHA without the collusion of SHA personnel inside SHA. So what we are asking is please let's take a very broad view on this issue of fraud. There is people who are conducting fraud inside SHA today. We know facilities are being asked to pay money in order to receive payment. We know this. So when we are looking at fraud, let us not victimize one side of the equation, but look at it as an entire sectoral issue.
Gilivotia vilingi wa mauvo kuma kauntini ya Mombasa nita wa Angelina Musena.